I'm Anton Whalley, Partner Technical Specialist at IBM, and I'm joined today by Rob Kelly, CEO of Heart Rhythm Ireland. Rob, thanks for coming in. Rob, can you give us a bit of background on HRI?
Yeah, great to be here. HRI is a cardiac rhythm management platform. We've been operating in the Irish market for the past 15 years, providing the platform to hospitals throughout the country. So we have just under 50 hospitals across the country, which is nearly 100% coverage. We have over 65,000 patients on their platform. We've issued over 100,000 cardiac device ID cards to those patients. We are also the national registry for implantable cardiac devices in Ireland. The platform stayed quite static, done what it needed to do and provided a good service, but I had ambitions to scale the platform and HRI, and I knew that we needed to rebuild the platform to help do that. When we started working with IBM and you guys came in with your build teams and a co-creation, that changed the landscape for us, and our development team got to work hand in hand with the IBM team, and that really fast-tracked our development. And what we've done in the past 12 months has been exceptional on bringing to where we are from a static platform to something that is now scalable across the globe.
Yeah, and I think just to give people watching this a bit of an idea, kind of what was the process that we walked into, sort of what was the timeframes that people were working to?
Yeah, so before the automations that we have offered to the hospitals, there was a lot of manual input to our platform. So they would, at implant, they would look at the cardiac device, they would take the information from it and manually type it into HRI. We have a fully automated system now where it can be scanned in at implant, so it's barcode scanned in. All that information is now 100% accurate, so there's no room for error there, which brings a lot of accountability and traceability to that whole area, which is critical for patients and critical for clinicians from an EU regulation point of view, that they can comply with those regulations by having 100% accurate data at implant. And then throughout the follow-up of those devices, this is where there's a massive time efficiency brought to the table, where initially they could take 15 to 20 minutes to type up a report on a follow-up. With our automation now, we will take that data from the programmer, have it in our cloud, and sit and waiting for the clinician within 30 seconds of that follow-up happening. And then the clinician will spend the next few minutes finishing off the report. So they've gone from a 15 to 20 minute process to a 3 to 4 minute process. And that's, if you put that across 65,000 patients across the country, that's a significant saving on time for the health sector.
You're deployed into hospitals now. We've got pilots going, etc., etc. But where are you thinking of taking HRI?
So from a clinical point of view, we believe we have the best cardiac rhythm management platform available globally, and we want to bring that to new territories. We want to bring it across Europe, the US, Australia, and we believe that IBM are going to play a big part in that rollout, and the global expertise, the in-market expertise IBM have will help us to achieve our goals. AI is a big part of what we're working on at the minute. We have one of the biggest data sets of cardiac device data across all manufacturers globally, as far as we're aware, and we have that built over the last 15 years. So we are currently working on our AI modeling to deliver predictive analytics to clinicians using Watson X AI. So that's a really exciting project, and we're really looking forward to actually getting that to a level where we can deploy that into the hospitals. The other side of the AI is with the patients. So we give the patients the physical ID cards, but we have brought that to the next level where we're delivering a virtual cardiac device ID through mobile applications to patients. So we're actually looking to improve their quality of life through utilising Watson X.